Hello and welcome. Can you start off by telling us a little bit about yourself?
Okay, so my name is Abbie McNett. I am a licensed master therapist, and I'm currently working towards getting my clinical license. And I am a wife, and I have a toddler and one on the way. So some of this will be from the professional point of view, but also from personal experience.
Okay, so what is the importance of maternal mental health?
So maternal mental health is important for everybody, not just the mother, but for anybody that's going to be involved in the pregnancy or afterwards, especially those that are probably directly in the household. Everybody to be supportive of the mother in this journey.
So what are the signs and symptoms that someone may be struggling with burnout, especially in motherhood?
Okay, so burnout, a lot of times people relate burnout to working, but you can feel burnout you can feel burnout in school, motherhood, work. You can feel burnout in many different places. So they define burnout as physical, emotional, or mental exhaustion, accompanied by decreased motivation, low performance, and negative attitudes. So some causes of burnout would be inadequate support, financial or other life stressors, some perfectionism, or prior mental health issues. Some signs and symptoms of burnout would be exhaustion, feeling overwhelmed, feeling fed up, frustrated, or dissatisfied, and then especially motherhood, wanting to distance yourself from your children, feeling useless or feeling depressed.
Okay, so what would be the risks of someone continuing in burnout?
Okay, so some of the risks of a mother continuing in burnout can negatively affect, because if I'm with my child and I'm having burnout and I don't have the adequate support that I need, or taking time for myself, it just kind of increases. And so the risk of me continuing in burnout would be that I can develop depression or anxiety, or I can, in extreme cases, come to the point where I would likely neglect or hurt my child, even though I may not want to, but you're kind of not really thinking, at full capacity whenever you're struggling with that.
Okay, so what boundaries can mothers set to avoid that burnout?
Okay, so there are lots of different ways that you can set boundaries. It's important that the people that you set boundaries with know what your boundaries are and they respect your boundaries. I know a lot of times, especially in the beginning, whenever we have our babies, a lot of people set boundaries for whenever you're coming home from the hospital, making sure people wash their hands if they're not sick, or making sure they don't wear perfume and stuff like that. But keeping boundaries throughout raising our children is also important. So talking with those family members about the boundaries that you set, making sure that they understand them and are aware of what the boundaries are. Some of the boundaries that you can set is to make time for yourself, because you're also important. And like I said before, if we're not taking care of ourselves, we can't take care of our kids. So self-care is important. Your priorities, getting straight on your priorities and deciding what is important. Some days we might not follow our own boundaries. Clear communication. And whenever you're setting boundaries, you're not responsible for how others respond. I like to tell people, if you set a boundary and others are not okay with it, then maybe they're not the people for you. Making sure that your partner helps and is supportive And then some ways to practice self-care would be to take time to do things that you enjoy, taking time for yourself and taking care of yourself, like eating good, possibly exercising, drinking enough water, taking medications if you're prescribed medications. And I know getting enough sleep is hard, but sometimes we may need some extra sleep, and practicing good hygiene. Listening to music or reading books or going outside, practice gratitude, set goals and priorities are some self-care that you can practice.
Okay, so how can mothers work to help manage their anxiety?
Okay, so the American Psychological Association defines anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes such as increased blood pressure. So some symptoms of anxiety would be uncontrollable worry, poor concentration, excessive nervousness, increased heart rate, sleep problems, upset stomach, muscle tension, or avoidance of fear. Some coping skills or ways to manage that would be to, first of all, find out what is possibly causing the increased anxiety. Maybe either take a break from it or eliminate it completely if possible. I know that we can't eliminate all of our anxious thoughts and what causes them, but some ways to cope with it would be deep breathing, aggressive muscle relaxation. You can watch videos on how to do that. Grounding techniques, I like to suggest the 5-4-3-2-1 grounding technique, and that's where you do 5 things that you can see, 4 things that you can feel, 3 things you hear, 2 things you smell, and 1 thing that you can taste. Medications also may be beneficial for anxiety, but of course see a professional for that. Planning ahead, which is hard whenever you have kids, but sometimes planning ahead can help you with that. Practicing mindfulness, exercise, getting enough sleep, staying hydrated, and eating well. So as we've talked about anxiety and burnout and depression, it is important to know that not everybody feels the same symptoms or their struggles look the same. Not everybody benefits from the same coping skills. Some people struggle, like you could have 10 people in the room and they all struggle, or their struggles look different for each one of them. And then coping skills are not a one-size-fits-all. So it's important that you find out what works for you so that you can use it whenever you need it.
So what resources are there available for mothers in Central Louisiana?
So of course there's the Cenla Pregnancy Center. That is a good resource for mothers in Cenla. There are a few therapists that I have found that are some in Cenla, well, one in Cenla, and her name is Crystal Atkins, and she specializes in postpartum depression. Or Kristen Baroni, if I'm saying that right. She's the LPC, and she's based out of Lafayette, but I believe that she does telehealth, and she is a perinatal mental health certified, so she knows about that too. Some other organizations that I have found is the Mama Wellness Foundation. It's Louisiana and Texas based, but it is specifically for Black mothers, and they do different things. They have therapy, they do diaper donation and basic essentials. They host events. I know they have one coming up in Baton Rouge. And then they are starting a financial literacy and credit building course, but that's not going to start till like July. There is the Cenla Playdates and Mom Breaks, which is here in Cenla. They have playdates, mom breaks, and then family meetups. So it could be moms just needing to get together with other moms to talk about the struggles that they're having and see, how they can relate, or getting their kids together for the play dates, or bringing in whole families together. I know that I've said that you need to take care of yourself before you can take care of your kids. But a lot of people feel like they don't have the support to take care of themselves. And so a good way to build your village would be to go to those play dates or the mom breaks, and you can build your village for people that can support you.
So do you have any words of encouragement to other moms out there?
So probably the biggest thing is that no parent is perfect. We all make mistakes. There's sometimes that we feel like we're the best parent ever, or there's times that we feel like we're the worst parent ever. So giving yourself grace. A lot of times it can be easy to reminisce on the bad times, but it's important that you stay focused on the positive times and the good things that have happened, and allow yourself to ask for help if you need help, and finding your village. I know a lot of people don't have a village, but it really does take a village, even if your village is smaller than other people's village. It's leaning on those supports that's important.